Researchers are debating the strength of evidence connecting technology to surging rates of adolescent mental illness, but they have some clear advice for parents. There's a book perched near the top of the New York Times bestseller list about what's wrong with kids today. The Anxious Generation, 2024, by psychologist Jonathan Haidt, argues that increasing time spent on smartphones and social media at the expense of play is rewiring the brains of children and adolescents and driving soaring rates of mental illness. It leapt to the top of the bestseller list when it was released a year ago and has sat there ever since. The book reinforced an acute concern among many Western parents about the time that their children spend on smartphones and other screens. In a 2024 survey, nearly half of U.S. teenagers said they were online almost constantly, compared with 24% a decade earlier. See, constantly online, and 1/3 use social media sites, such as YouTube, almost all the time. Parents are troubled by this technology because it's new, it's different, and it's not the way that they were raised, says psychologist Sarah Coyne at Brigham Young University in Provo, Utah. Although researchers agree that adolescents are struggling with mental health, there is fierce debate about how much phones and social media are to blame. Some scientists say the copious research done so far does not show a large effect of these technologies on teenagers' psychological health. Science to date does not support the widespread panic around social media and mental health, says Candace Odgers, a psychologist at the University of California, Irvine, who has criticized Haidt's conclusions. Scientists acknowledge that smartphones and social media can potentially be harmful for some people if screen time displaces healthy activities such as sleep, or if posts encourage them to self-harm, for instance. But these tools can also help people connect to support, advice, education, and friends. The impact depends on the individual themselves and their history and their physiology, the content and the context, says Coyne. And many researchers are concerned that parents and children are hearing the alarming message propagated by Haidt's blockbuster book and major media rather than the more nuanced one suggested by other scientists. Some authorities, meanwhile, are moving to ban phones from schools or restrict teenagers' access to social media. Parents and kids are very aware of the narrative and very worried, says Megan Moreno, an adolescent medicine physician at the University of Wisconsin-Madison. That sparks family battles over screens and leaves parents unsure what to do. No one denies that adolescent mental health is a huge concern. Research shows that over the past 2 decades, rates of mental illness have been increasing in adolescents in many countries. For instance, surveys of U.S. adolescents found that the share reporting symptoms of depression rose from 16% in 2010 to 21% in 2015, mostly due to increases in girls, and that rates of suicide rose from 5.4 to 7 per 100, 0 in the same period too. Researchers suspect that some of these trends could be down to increased awareness and reporting of mental health concerns, but they have also searched for other causes. Many scientists have looked for correlations between measures of screen or social media use and mental health in cross-sectional studies, which collect data at one moment in time, or longitudinal studies, which track people over time. Although some studies have found benefits, others have reported harms. A big weakness in such analyses is that they often rely on participants self-reporting the time they spend on screens. This is usually inaccurate, because people can't remember or are embarrassed to answer honestly. Some researchers have observed potential benefits for certain groups. Coyne researches underrepresented populations, including transgender and non-binary youth, and she says they're using their phones in really effective ways, a lot of the time to find belonging and community 7. By contrast, a small proportion of young people do use their smartphones or social media in problematic ways, researchers and physicians say, and there is debate about how to define and diagnose what constitutes pathological use. Nothing one does for 8 or 9 hours a day except for sleep should be viewed as a healthful activity, says Dimitri Christakis, a pediatrician and researcher at the Seattle Children's Research Institute in Washington. And for some, social media use can lead to devastating consequences. In September 2022, for instance, a London coroner's inquest found that 14-year-old Molly Russell died from an act of self-harm while suffering from depression and the negative effects of online content. The inquest heard that Russell had viewed content about self-harm and suicide on the platform's Instagram and Pinterest before she took her own life in November 2017. During the inquest, a representative of Meta, which owns Instagram, defended the platform's policies, and a Pinterest representative admitted that the site was not safe when Russell used it. In response to the inquest findings, both firms pointed to ways they were improving their sites. Last year, Instagram launched teen accounts, which restrict the content young users can view. Such cases are horrific and tragic, and lead to understandable fear among parents that something similar could happen to their child. But jumping from anecdotal cases to an assumption that social media is a terrible peril for all teenagers is problematic, she and other scientists say. That's a genuine fear, says Coyne, but the likelihood of that is really, really small.